Welcome to Thoughtful Thursdays. Today we're going to talk about children's health, and we're delighted to have with us Dr. Girlie, who is a pediatrician, which means a doctor for children. And she's going to tell us more about lifestyle aspects of children's health care. Is that correct?
Yes, doctor. Thank you for inviting me over. And I think this topic is very timely, especially to our, back to school campaign.
Okay, so what's the Back to School campaign?
So it's actually our recommendation for parents on what to prepare, especially kids need something, in preparation for the school.
So, what do we need to prepare the kids for school for? Is it our children? Do they need some guidance?
Yes, perfectly. So every kids needs guidelines, especially with regards to their nutrition, to their exercise, and in getting adequate sleep.
Which are the problems you think that need to be addressed?
So with regards to the nutrition, so most parents would come to my clinic, okay? They would ask what are the best foods, that they can give for their kids' growth and nutrition, and of course their development. And also they would ask regarding how can they encourage their kids to eat fruits and vegetables. And at the same time, what are the food that they can prepare for school lunches that is both healthy and appealing. So that is just on the part of the nutrition. So on
So,
the
is it your experience that children are resistant to fruits and vegetables? They don't like them?
yeah, that is the common dilemma of parents. But it's very common for kids to be selective about food. But everything should start from home. So parents should model, the proper eating habits so that kids can see what is really beneficial for them. And parents should educate, these kids, especially on the healthy options that they can get.
And what is the proper bedtime for a child? At what time should a child be told by their parents, okay, it's time to sleep, I'll read you a
Okay.
story?
Yeah, that's a very good question also. So regarding sleep, so we should start as early as toddler years. So parents should set, a soothing or calming environment that is, and it should be consistent. They should stick to it every night so that kids would follow. Yeah,
So it's like a rhythm that they have to develop.
exactly.
And what is the proper time? What do you advise parents to do? 7 o'clock, 8 o'clock, or is it earlier or later?
Yeah. So during their visits, we should usually recommend what is the the amount of sleep that is recommended based on their age group. So if we are talking about toddlers or kids, so from between 3 to 5 years old, they should get at least around 10 to 13 hours of sleep, which includes nap times. And for kids 6 to 12 years old, they should get at least like around 9 to 12 hours.
So it's more about the amount of hours than the
Exactly.
actual timing of going to bed.
Yes, yes,
All right.
yes.
But if you have to get up in the morning to go to school, then, that immediately influences what time you have to go to bed.
Yeah, so if these kids are really preparing for school at around, shall we say, 6 o'clock, especially that nowadays, the waking time is so early, then they should get up to bed or prepare to bed like around 8 or 9 o'clock.
I think that many people are struggling with the fact that their children are so into gaming, and that when bedtime comes, they want to do, they want to play games, computer games. I'm
Yeah.
especially talking about. Can you tell us a little bit more about that, and what can parents do to manage this situation?
Okay. So basically we are talking about, screen time, for kids. So during their visits, we usually recommend what is the amount of hours that is allowed for these kids to do or to use their gadgets during weekdays and during weekends. So it's very important that they have to stick to that. Discipline and consistency is very important for these young kids. And they should stop using these gadgets an hour or 30 minutes before they go to bed. They should create, a very calm environment for sleep. So this could be reading a book, okay? Or doing or singing songs along
Yeah.
with the parents,
Yeah.
especially for the younger kids. So these little things actually matters a lot.
And now in our 21st century, are there still parents who read bedtime stories for their children, or is this practice just gone?
Yeah, I think so.
Oh, there are still.
There are really parents who are quite, educated and they wanted to start early well because, habit is, it should be done repeatedly.
Yeah.
The fact is that you really have to do it more than 2 months, shall we say 66 times for it to become a habit.
Yeah, yeah.
And for others, they can even do it up to 8 months to be into their system.
Yeah.
Yeah.
Is there also a limit to, let's say, the time before going to sleep where you should stop your child from, let's say,
Yeah.
exercising and jumping up and
Correct.
down,
So
or does,
at
yeah?
least 30 minutes to 1 hour, you have to settle your kids. This would signal the kids that they have to sleep. Okay? And a part of that is to limit the screen time.
Yeah. Do you think there's a relationship between, let's say, a common phenomenon in society like attention deficit disorder and the lack of sleep and, let's say, bad lifestyles?
With regards to attention deficit, so it's very difficult to really point it out, but attention deficit can also have a manifestation of difficulty in sleeping.
So it might be the other way around. That
Yeah,
from
exactly.
the attention deficit, people have sleeping
Yeah,
trouble.
so those kids are more prone to having difficulty sleeping actually.
Okay. And are there any tips and tricks that you could give parents that could, let's say, that could encourage them to make this change in the lifestyle?
Yeah, so we should understand that it's very important to develop these healthy habits early on because we will be discussing what could be the long-term benefits and how these habits can really affect their lifelong behavior. So eating healthy foods, exercise, staying active, these are not just feeling good about themselves now, but it actually shape or prepare these kids for success in school and in life.
And what can we do to create awareness in society? Should we be doing this podcast every week? Or
Yeah, that's another thing. And a part of that also is to visit their pediatricians,
Yeah.
especially like we can say a week or two before the school starts or before the year starts, so that we can outline what are the screenings and the health checks that is important, and as well to update their vaccination. Okay, because these are the things that can keep their kids healthy, physically healthy, and at the same time ready for the school environment.
But don't you think there's a role for teachers in this? I mean, because the children spend a lot of time with their teachers, especially if it's a
Exactly.
homeroom teaching.
Yes.
So do you guys reach out to schools and
Yeah, so we can do also visits and some talks on the in school. How to promote these healthy habits that we say.
Dr. Girlie, it's been so interesting talking to you. You've talked about things which are interesting for so many people. So many people are struggling with these things with the young children that they have, and I'm very thankful for you sharing your expertise and giving your time to us. And I'm looking forward to having people responding to your advice. Thank you so much.
Yeah, it's been my pleasure, Doctor.